Welcome to the Employco HR Chat. I'm Rob Wilson, and with me is Jason Eisenut.
Hey, everyone.
Thanks for joining us this week on our HR Chat. So, Jason, it's health insurance season. Open enrollment's going on. Well, not quite open enrollment, but
Yes, right around the corner.
right around the corner. Renewal rates are being calculated, so everyone's looking at the new plans. And every now and then you run across, spouses, working spouses are covered in a couple different places. So thought we'd walk through best practices for how do you do that carve out with
Yeah.
employee spouses that may be working elsewhere that have coverage elsewhere.
Yeah. So this conversation is just about spouses who are working and the spouse's employer does offer group health insurance.
Right.
So if either my spouse doesn't work or they're working part-time or their employer doesn't offer it, that's a separate issue.
So you don't have to listen then.
But yeah, for employers, they can't, there's no federal law. First of all, there's no, even Affordable Care Act, there's no federal law that requires employers to cover spouses on their group health insurance. There are some laws that say you have to offer children coverage on your group health plan, but not the spouses.
But best practices,
Right.
everybody offers coverage to spouses.
Right.
And in majority of cases, you may either the companies don't pay for it or they may pay a minor portion of it.
Yeah. Good point.
The days of companies paying 100% of your family coverage
Long gone.
You don't see it anymore.
So if you do offer coverage that extends it to a spouse, some employers are saying, okay, well, this spouse has access to health insurance at their job. The employer can, if according to, as long as there's some state rules that would prohibit it, or maybe your insurance plan certificate may not, but as long as your state and plan certificate allow it, you as the employer could say, you as a spouse, if you have access to your health insurance at your employer, you can't enroll in our plan. As an employee, Jason, you can't enroll your wife, Julie, if Julie is working and she has health insurance at her employer. We don't do that. I'm just using an example.
Right.
Or Employco could say, Jason, your wife is working at an employer and she's got health insurance there. We'll allow you to put her on your plan, but you're going to get a spousal surcharge, $50 a month, $100 a month.
On top of the premium.
On top of the premium. On top of what a normal employee would pay for employee plus spouse coverage. Now, all of this is kind of on the honor system. It's usually an attestation form or an affidavit the employee would say, my spouse, Julie, does or does not have access to health insurance at his or her employer. So that's kind of on the prohibitive side for bringing in spouses into the employer plan.
Right.
And very rarely, we've heard of one or two examples of the employer completely blocking the spouse from coming into the plan. More often, they're going to increase the premium, the cost of the employee to do that.
So, in the Department of Labor has no issue with that of you surcharging because you as the company, the employer, you're keeping that money. You're not. The insurance company is not charging that.
Right. And let's say the insurance, let's say it would be, I don't know, $1,500 for employee plus spouse, and you as the employer maybe pay 50%. So it normally would be $750 a month for the employee to cover their spouse, but you learn that the employee's covering, or the spouse has insurance through their employer. Maybe you now charge that employee $800 a month instead of the $750 to be covering their spouse.
Right.
The other way is some employers are incentivizing their employees to go on the spouse's plan.
Right.
So I have a wife, Julie. She's working for a different employer. She has access to health insurance, and her company does offer spousal coverage. Employco could say, Jason, we're going to incentivize you. We're going to pay you $100 a month to not take our plan, to go on the spouse's plan. It's taxable income to me, but it is an advantage, kind of an incentive for an employer to get I'm not saying it's good or bad, but there is an option for the employers to do that to get the employee to incentivize them to go on the spouse's plan.
Because in our office, if someone like in your case, if you're covered under your wife's policy, we give you you can't take so we give a monthly dollar amount to the employees. So you can have that in cash, but you can use that then to buy dental insurance or short-term disability or life insurance. All of that won't add up to what your premium is, but it's a nice incentive for someone that if you're on your spouses that you can get dental insurance for your family or something.
Vision. Yep.
Right. But you are seeing more companies try and push people off their health plan because healthcare is so expensive. When you look at Blue Cross in Illinois, and if you're over 50 employees, the renewal this year is starting at 25%.
Yeah. Highest increases in over 10 years.
Yeah. We just ran into a couple guys on our sales team, ran into a company on the East Coast that they got a 75% rate increase.
Wow.
Like, even if you negotiate that down, you're not going to get it down to
Right.
25%, but how do you afford that type of increase?
Yeah.
You know, so it's this is the largest uh, renewal increases in since Affordable Care Act.
Yeah, right. Yeah.
So it's a tough year for healthcare for businesses. So you can see why companies want to push their employees to
Trying to get
spouses.
creative.
Yeah. So, but if you have questions on your health insurance or thinking of something to do with the spouses for coverage elsewhere, or just HR questions in general, feel free to reach out to us at hr@employco.com. That goes right to Jason. Happy to help, especially with healthcare. They just announced this past week inflation's at 3%, but here nationally, healthcare is trending at 14%. I mean, it's
Yeah. Way out of whack.
yeah, it's a tough year for businesses. So happy to and our renewal was substantially less than that. So we came out okay. But
Yeah.
and I appreciate the great job that you and your team do on handling
Yeah.
that. So feel free to reach out to us if we be of any help.
Thank
So
you.
thanks for joining us.